Good afternoon, everybody, and thank you for joining us. My name is Samantha Holloway. I'm the EWMA Education Chair and Reader based in the School of Medicine at Cardiff University in Wales, the UK. The COVID-19 hit Europe 1 year ago and is still causing loss of human lives, as well as major challenges to the healthcare systems across the world. Frontline healthcare staff members are among those most significantly affected by the virus due to daily meetings with COVID-19 patients. This requires use of effective protective equipment throughout the day, and this often leads to discomfort and painful skin reactions or lesions. The focus of this webinar is how the risk of skin injuries can be limited or avoided via correct and suitable equipment. This webinar is the second webinar that EWMA is hosting on the topic personal protective equipment and skin damage. You can also find a podcast on the topic at the EWMA website. This webinar will feature a debate with focus on PPE materials and fitting in connection with the previous episodes on the skin damage. For more in-depth presentations about PPE and skin damage, please view the previous webinar, which is available on demand via the EWMA website. This webinar will also be recorded. The recording will be available via the EWMA website within a few days. You will be able to request a certificate of attendance for the live participation in the webinar if you participate for a minimum of 75% of the live webinar. A link to the certificate will be sent after the webinar. This webinar is sponsored and supported by an unrestricted grant from 3M. 3M has had no influence on the planning of this webinar, but are represented in the panel to present perspectives from the point of view of producers of PPE products. In this webinar, the panelists will discuss some predefined questions for approximately 45 minutes. After this, we will discuss questions from the participants. Please use the question and answer box, the Q&A box for this. You can type your Q&A in the box at any time during the webinar. I will now welcome the panel onto the screen. We have with us today Kimberly LeBlanc, who's an advanced practice nurse and chair of the Wound Ostomy Continence Institute Canada. We have Elena Conde Montero, who is a EWMA Council member and a dermatologist at the Hospital Universitario Infanta Leonor, España. Karen Uzi, who is Professor of Skin Integrity and Director for the Institute of Skin Integrity and Infection Prevention in the UK. Alberto Piaggesi, our current EWMA President and Professor and Director of the Diabetic Foot Section of the Pisa University Hospital, University of Pisa, Italy. And Geert Driessen, who's 3M Clinical and Scientific Manager, Operating Room and Central Sterilization Solutions that covers Europe, Middle East and Africa. So welcome to the panel. We'll now move to the first question. And I'd like to ask you all in turn, what is the current status of management of PPE in your country in general? So Kim, would you like to start?
Sure. So first of all, thank you for inviting me again, Samantha. It's always fun to be able to collaborate.
Welcome.
You know, certainly like anywhere else in the world, I think that we're still struggling with our PPE use. Supply isn't as big of a problem anymore. So we're seeing different types of PPE related skin injury now. So initially we were seeing a lot of pressure related injuries from prolonged use of PPE and not changing it because we didn't have enough. Now supply isn't as big of an issue. We have enough PPE, but we're still wearing it all the time. So what's happening is that we're seeing more moisture related skin injuries. We're seeing the facial acne that many people are calling MACNE. So we're seeing the acne. We're seeing a lot of dermatitis on the hands. We're also seeing moisture associated skin damage from in other areas, especially in some of our maybe slightly heavier healthcare professionals, just because of wearing all the gowns and So there's more perspiration, we're seeing more moisture. So we're seeing a lot of different issues. We're also seeing our patients coming in with PPE related skin injury, because in Canada, masks are mandated. So we're seeing a lot of people wearing masks, some improperly, and a lot of people wearing gloves, many of whom are not wearing them properly. So it's an ongoing challenge that is morphing and changing as this pandemic progresses.
Yeah, that's interesting, Kim, actually, because we were thinking today of mainly being around healthcare professionals. It's interesting about the public now wearing PPE, and perhaps, as you say, incorrectly. So perhaps we can come back to that. Karen, I'd like to ask you the same question in terms of the current status of management of PPE in the UK.
Thank you, Sam, and again, thank you for inviting me.
Welcome.
We're very similar to Kim, actually. We can get the PPE now quite easily. The general public still often wearing it incorrectly when they're putting their face coverings on rather than face masks, as they will say, and whizzing them around in the air when they take them off, which is a bit worrying. But from a clinician's point of view, we can get hold of it. There seems to be no real issues, although some areas are saying we still can't get hold of enough of it, possibly more like your care homes and nursing homes. But we've very much got things more in perspective now, and people are being measured a lot better for fit testing and being fit tested for certain masks as well, and then get a bit like a passport, so that when they go from area to area, can say, well, I've been fitted for X mask and this is what I should be wearing. And then at least people know what's happening. Skin damage itself, we're still seeing it, because even though you can get hold of your PPE, exactly like Kim says, you're wearing it for such a long period of time, washing your hands so much as well, we're still seeing issues with skin damage.
Yeah, and it's an interesting point you made, Karen, about in the UK we have enough PPE now, because if you recall a year ago, there were all sorts of industrial partners who got together who didn't normally make PPE, who suddenly were making PPE to address the deficit in PPE equipment for us. So again, that's probably posed some problems for the UK. Elena, perhaps I can come to you in Spain and ask about your experience of PPE management at this moment in time.
The spectrum of lesions is very similar to other countries, and we don't have national guidelines like that, but the different Spanish wound care associations and the Spanish Academy of Dermatology and different healthcare institutions have published different recommendations. And we are, in the consultation, we are seeing more and more patients with these problems, because in the previous months, people did not come to the dermatology department to ask for advice. And now, as Kim said, we have lots of diseases that people are consulting for, such as acne.
Yeah.
It's very prevalent now. So it does not mean that in the previous months this did not happen, but now people are asking for advice more and more. And we have to take in mind, have in mind that Spain was the first European country that had compulsory use of masks in any outdoor setting. So this is from July. After the lockdown in May, we had it compulsory if the social distance could not be guaranteed. But from July on, mask use is compulsory in any outdoor setting in Spain. So that's why people is more and more with is spending long periods of time with masks. And as far as we know, spending time with masks, spending time with PPE is the most important risk factor to develop lesions.
Yeah. Okay, thank you, Elena. And Alberto, the same question for you. Obviously, Italy was hit very hard first thing, over a year ago. So perhaps you have a little bit more experience in your country of the long-term effects. But in terms of currently what's happening, what would you say?
Yeah, we had a number of problems in the beginning with getting the devices available, since since the 20th of March of 2020, also in Italy, was decided to be compulsory wearing mask for whoever, whenever, mainly out of the home. And there was also a case of corruption, since because of this difficulty in getting the devices available, there was a number of attempt of frauds, getting non-adequate devices from abroad, not certified. But now the situation is much better. We are talking of 60 million people country, so it's a huge number of people. Now, more or less is well accepted, and everybody is compliant with this prescription. For technical use, the criteria varies for general use and in hospital use. Mm-hmm. In many cases in the hospital use, we have to wear 2 masks instead of 1 mask, and 2 gloves instead of 1 glove, mm-hmm. and also gowns. So I would say that the protective devices are much more represented inside the hospital, and varies in quality, depending on the level of I would say vicinity with the problem. Mm-hmm. So if you are in an ambulatory setting exposed to public, for instance, you have to wear more devices than if you are inside the wards where people are screened at the beginning. So they're supposed to be COVID-free. Mm-hmm. Paradoxically, the more there are, the more complex relationship with protective devices are for those who are exposed to non-screened population. So for us for instance, that we are huge ambulatory setting and activity, we are more exposed and using protective devices.
Yeah. Yeah. Okay. Thank you, Alberto. And to move to you, Alberto mentioned about the quality of PPE. So it'll be interesting to get your perspective from industry in terms of what you've seen over the last 12 months in terms of how PPE is being managed across Europe and the wider countries that you're responsible for.
Very interesting. And first and for all, Samantha, also from me, thank you for the invitation. No problem. I think there are, if I look back over the past 12 months, then as everyone said already, in the beginning, there was lack of supply. We couldn't produce enough to satisfy the market, so to speak. That is one thing. What we did as industry in total, and I can only speak for 3M in particular, but in 3M we doubled and maybe even tripled or quadrupled the production, and we are now in, I think, a reasonable shape if you look at delivering our products to the market. So as most people say, we do not have lack of PPE at this moment, I think. So that is, having said that, and looking at the poll question, the fact that PPE related skin issues is increasing is obvious, and that is logical. If you are using more PPE, you will automatically see more disadvantages and more complaints. So that is, I think, obvious. But what I see, and I'm also involved in regulatory and standardization and European standards and even also in ISO standards. But what I see is that too often people, healthcare workers, are wearing the wrong products, or they are wearing the right products in the wrong way, or they are wearing the products in the good way, but they handle them wrongly. So that is definitely one thing. And maybe I think we will elaborate a little bit further on that in the next questions. What we need to make sure And what we need to say is that a surgical mask or a procedure mask, at least in Europe, in the countries under the European Union, a surgical mask, a procedure mask cannot, shall not, should not be considered a protective equipment. Also not the community masks, which Elena very right said that started to be mandatory in Spain as the first country in Europe, but also those masks, all those masks are not PPE. They will, in other words, they will not protect the wearer of those masks. If you want to be protected in Europe, you need to have an EN 149 certified protective device, and it should be printed on a device. If you're in the US or in other areas, it might be N95. But a surgical mask will not protect the wearer. That is what we have to say. And that is also one of the issues of using the wrong product for a protective purpose.
Mm-hmm. Yeah. I think there's a number of things you've raised there. It's the confusion about what are facial coverings, what are facial masks, what's PPE. And I think, you know, we have to think that PPE or protective equipment of some sort is here to stay. You know, moving forwards, I think we're all going to have to change the way we are in our day-to-day lives, I guess. So you've touched on this already, many of you, but just to come back to the challenges of particularly of skincare that clinicians are currently facing. And Elena, I'll start with you from your dermatology background. If you can sort of briefly tell us, you alluded to this and that patients are now presenting to you with skincare problems. So what are the main skincare challenges that you're currently seeing and facing? So Elena, if you could unmute. Thank you.
Main challenge is that adequate PPE means occlusion. And in terms of skin, this is a warm and a close environment that implies excessive sweating, excessive moisture, friction. So in pressure areas such as the nasal bridge or the cheeks, we may have ulcers or ulceration. But the real problem is that this moist environment will impair keratinocytes, migration and division. We release lots of inflammatory cytokines. We imply an overgrowth of bacteria, and this is the cause of erythema, skin dryness, urticaria, and acne, rosacea. And the problem is that people will suffer the aggravation of pre-existing problems. Those people with acne or rosacea or seborrheic dermatitis will have relapses. And another problem is that in these conditions, the skin is more prone to develop irritant contact dermatitis and less frequently allergic contact dermatitis. Allergies are not the most common situation, but in this context of occlusion, this may occur.
Okay, thank you, Elena. Kim, perhaps I can come to you next. I mean, I think Canada was one of the first countries we saw produce guidelines very quickly about skincare and the challenges clinicians are facing. So I guess, you know, have you seen a difference in those guidelines being in place? Or are you still seeing the same challenges of skincare that those guidelines were produced to address?
So in some ways, we're seeing a lot of improvements. And I think Elena brought up a really great point in that when you have a pre-existing issue, then it's going to certainly exacerbate that. Since we put out our guidelines and we've gotten more PPE available, we have seen fewer pressure-related injuries, which has been really good. And we're in the middle right now, Dr. Wu and myself, of doing a pan-Canadian survey to see what the extent of PPE damage is in Canada. But what we're hearing anecdotally is we're seeing fewer of the pressure injuries. But part of that, and this comes to what Gerrit was saying earlier, is that we have an issue as well with how the PPE is being used in Canada, simply because we don't have a wide range of N95, that's what we use in Canada, use outside of acute care. So, and even within acute care, its use is very limited. So we're seeing more of the procedural masks being used. So there's a lot of question out there around, are we protecting ourselves well enough? Mm-hmm. That being said, we don't have a huge number of healthcare providers being infected with COVID-19 in the workplace. So there must be some, you know, with everybody wearing masks, we get protection on both sides. That being said, we do have a lot of problems with acne, rosacea, exacerbations of sub-Ks, things like that. We're seeing a lot of hand dermatitis, mm-hmm. a lot of other moisture-related skin damages. And these are the things that, you know, are impacting work, because what we are finding is that our healthcare professionals are saying, well, I constantly break PPE because my face is so itchy. So I'm removing my, you know, or I'm touching my mask because it's hurting me. So these are concerns that we have in terms of protection and safety.
Mm-hmm. Okay, thank you, Kim. And Alberto, in terms of the situation with you and skincare challenges that clinicians are facing, what would you say are some of the most common problems?
Well, I want to stress the fact that we are talking mainly of masks, but really, at least in our place, in our practice, we are, again, a variety of different devices that we have to wear. Mm. And not necessarily the major problems comes from masks. In my hospital has been very soon established a dermatologic service for the caregivers, the professional working in the hospital who were referring this kind of problems. My friend Marco Romanelli was in charge of organizing this. And actually, it came out that the most frequent problems came from growths, not from masks, okay. Just to mention. Mm. And the second one was psychological adaptation, mm-hmm. Bad psychological adaptation to this kind of new, I would say, way of working. Mm. Because you have to imagine to wear this complex and difficult to wear variety of devices in an order, because you have to follow a certain order not to compromise the work procedure. Yeah. And then staying inside, like you were a scuba diver or something like that for 6 to 8 hours, with the rotation in order to give you the possibility of going to the bath or, you know, having a breath every 4 hours. So these are situations in which not only the physical adaptation come in place, but also some. And there was a number of cases coming out of this situation with some difficulties in that. Mm. And more than this, beside this, there is also the fact that also the interaction with the environment is complex and complicated, especially if you, like me, you are wearing glasses. Yeah. Yeah. And you need to wear glasses to see what you're doing, especially if you do some surgery, for instance. And if you, on the surgery, you need to wear also not only the normal surgical masks, but something like this. Yeah. Then it comes a little bit complicated. And, you know, this is not only problematic for you, but also maybe problematic for the patient. So there's a number of issues that came in the discussion, and I think that it would take, when we think of, I would say, guidelines or indications, we should take in consideration also these aspects.
Yeah, some really good points there, which we see if we have time to come back to, Alberto. And finally, Karen, do you think in the UK we're facing any different sorts of skincare challenges?
I think it's very much the same globally, Sam, but what we really need to be aware of is we've all done guidelines, they've all been published out there, but if you physically can't, like Alberta's saying, come off the wards or come out of theatre to release the pressure or go and wash your skin or have a good itch, then whatever your guidelines are, it doesn't matter because you can't physically get out of that environment. And I do think we're using face masks and gloves while we're at work, obviously, and PPE. Then you're going back home, you put your mask back on again to go back home. So your skin's getting very little chance to relieve itself throughout the day, being at work or in your own home. I think gloves when you're outside are maybe less of an issue because I'm not sure that we wear them. That some people wear them all the time for some bizarre reason, but we don't generally wear them all the time when we go out. But I think your facial coverings for your face, you're constantly keeping your skin under there, so acne and everything else is just rife. So I think we can give all these guidelines, we can give all this advice, but physically, can we actually implement it?
Yeah. Again, we might come back to this, Karen. So Geert, if I can ask you from an industry perspective on materials and particularly mask fitting, you've heard a number of challenges that the clinicians across the world are talking about. You know, how can these challenges be addressed from a manufacturing perspective? You know, can they be taken into account, sort of these temperature differences, the fact that they're having to be worn for so long? So if you can maybe give some sort of brief overview on some of those things. Geert, you're on mute. Yeah, thank you. Thank you.
I'm here now. Many things have been said, and they are all very true. Let me first start with, I think Kimberly made a remark on how many healthcare workers are affected due to their work on COVID. The ICN did an analysis, International Council for Nurses. They did an analysis and they published that on their, I think, on their website. And they, if they extrapolate the results of, I think, a survey they did in 45 countries, if they extrapolate it to worldwide, up to an excess of 20,000 nurses have died because of COVID due to what they encountered during their work. So with this, we are talking about serious numbers worldwide. That is one thing. If you look at the skin damage, I think it was Elena and again Kimberly and also Karen and Alberto, they all said, okay, the skin damage is due to the heat buildup within the mask as well as the moisture content. And I think that was Elena and also Kimberly saying that. And that is true. And you can, you know, preventing skin damage always starts with do not ignore if you experience any discomfort of a mask. That is an important thing. Many healthcare workers worldwide, they still have that, what I always used to call Florence Nightingale attitude, meaning placing the patient in the center of all activities and do whatever it takes, even if they have to suffer to make that, do the best for that particular patient. I'm a big fan of Florence Nightingale and the Florence Nightingale attitude. But you know, you can only provide good healthcare with healthy healthcare workers. So it is about time that healthcare workers also start thinking about themselves, their own health. So never ignore the discomfort. Now, what is crucial, however, is that if a protective device is not fitting properly and in a good facial fit, and it can be very tight, then it doesn't work. What we see very often is that people with beards are wearing a respiratory protective device. And we know that facial fit of that device is compromised if you are wearing a beard. Even if you would, as a male, if you would not shave for 1 day, that stubble of 1 day not shaving will compromise the facial fit, will compromise the safety of the healthcare worker. So it is important to have that facial fit 100%. If you are wearing glasses, Alberto, as you were discussing and said, and if those glasses are fogging up, if you wear a respiratory protective device, it means that the respiratory protective device, the respirator, is not fitted properly. If air can go out, it can also go in. And it's easier for air to go inside the mask than to go out even. So if your glasses are fogging, your respirator is not fitting properly. That is what we have to realize. Then if you look at the respirator, disposable respirators, there are three types of devices. You have the unvalved respirators. They are just a mask without anything, and air, if you inhale, air is forced to go in through the filter, and also if you exhale, air is forced to go out through the filter. Due to that, there will be a heat buildup inside of the mask and also a moisture buildup. So that can lead to skin damage. That is the unvalved respirator. Then you have the valved respirators. The valved respirators, they have a valve in it, and if you exhale, the valve is opening and air is going through the valve. If you inhale, the valve is closing and air is forced to go through the filter. That means that because if you exhale, the valve is opening, the moisture content and the heat buildup inside of the mask will be significantly less than with an unvalved respirator. So if you want to protect only yourself, and if you do not need to protect the patient or the environment, like normal in an ICU, then I would recommend to wear a valved respirator, because that is reducing heat buildup, reducing moist content inside of the mask. And then you have a third type of device, which is the shrouded valve respirator. And there you have a respirator with an exhalation valve, and that exhalation valve is covered with a very tiny filter, just as a surgical mask, procedure mask. And that device is actually the good compromise between protecting yourself, protecting the environment. In principle, what is the single most important thing is the facial fit. What I always say is that if you want to have optimal protection, then it is a very cheap thing to do. You can realize it by putting a plastic bag over your head and seal it with duct tape around your neck. That is, you will never die because of a respiratory hazard. But that is not sustainable with life. So no. Everything what you do to make that more comfortable will increase the risk of contracting something. And what you have to do is to balance the risk of contracting something and the risk and comfort. Now, that is what you can do with valved, unvalved, and shrouded valve.
Okay, thank you, Geert. Some good points there, which we might come back to in terms of the questions that are coming in as well. So I'd like to just ask the participants now. We'd like to launch our second poll.
May I, sorry, before going on, may I clarify the point to Geert? Because he was mentioning the fogging glasses. I was not referring to this. Being a surgeon since 30 years, I learned a lot of tricks to avoid that. The problem with this is that the curvature of this what is the name in English? I don't know.
Visor.
Face shield.
And reflects the lights in a way that changes when you are in the operatory field, you may see wrong things.
Yeah, it's giving you a headache.
And this is important because if it's a call for better manufacturing of these things.
Okay. But, thank you, Alberto. It's a good point. Yeah. So to move on to another question for the panel, we have touched on this, so perhaps we can focus particularly on regulations in your own countries, if you are aware of any regulations in terms of the current research related to PPE. So particularly research-related activities that are going on in your countries in relation to PPE, and then also about any changes in regulations about PPE use. So Karen, can I come to you first in terms of research?
Sam, there's quite a lot of research going on at the moment, a lot to do with the fact what we've just been talking about skin damage as well for hands and face and other areas. I think what we failed to see at the beginning of this was that we did think one mask would fit all, but different people have different shaped faces, smaller faces, bigger faces. European faces are quite different shapes to people from the Far East, for example. So it's all about looking at how do we get different sorts of face masks. There's a lot of talk about 3D printing, personal masks, and having bespoke masks as well, which would be lovely. But I think we need to look at the cost of that as well, how we're going to get 3D printing and the time as well, because we can't be stood there measuring every single person, then waiting for it to print out, such like. So there is a lot going on, and looking at different materials as well. So materials that we can reuse and it still be clean and prevent spread of infection, or do we just go for disposable type of materials? But materials that are soft as well and that can make your skin breathe whilst maintaining that fit, because the fit, as we know, is the most important element, and different types of faces. Yeah,
and that's the point that Geert made. Kim, you mentioned a survey that's going on in terms of PPE skin damage, but are there other research projects going on relating to PPE?
So like Karen said, there's a lot of different research going on, a lot of it from the what do I call it? Our health and safety, looking at mask fit, looking at different ways to get good fits. As well, there was a fair bit of work being done, and our industry partner on this call will shiver just as I do with this, where they were experimenting with different ways to reuse PPE in terms of they started experimenting with how that they could re-sterilize it, so to speak, and then put it back out for use. And we had a lot of clinicians complaining of quite severe skin reactions. So they are slowing that practice down. It is still going on in some areas of the country. And, you know, as healthcare professionals, we're speaking out saying that this is off-label use, that it's not intended to be reused, and that they're putting healthcare professionals at risk by doing this. And there's no studies to show that what they're doing is actually going to protect us against contaminants. So, you know, there's a lot of different work going on right now. Some of it, the issues have migrated a bit because we have adequate supply of PPE. And, you know, we were thrilled. 3M is opening a plant in Canada for the manufacture of PPE. So we're excited about that. But, you know, there is a lot of people are looking at skin damage and how we can mitigate that. And so Dr. Wu and myself are looking at doing this, well, we're in the process of doing this pan-Canadian survey to find out just what is the extent of the damage in Canada and how does it compare to the study that's come out of Wuhan, China. Hiskey Smart has done a study that's come out of South Africa, and this is something I think we may touch on, but I'd be interested in the rest of the panel's take on this, particularly from an industry standpoint, because they're saying that it's safe to put thin layers of product, such as a thin foam, underneath an N95 or other occlusive PPE, and that it won't affect, that they don't need to be re-mask fitted. Our policy in Canada is that if you put anything underneath a PPE, you have to be re-mask fitted. That's our policy. So I'd be interested just to, I know I've just hijacked your interview a bit, Sam, but it is something that I would be interested in hearing other people's perspective on that.
Yeah, good. Without wishing to ignore Elena and Berto on this question, I am going to move to Geert for the purposes of time, because time's actually getting on. And Geert, can you briefly mention maybe some of the research areas? And I'll have to ask you to give quite a short answer in terms of maybe some of the research that's ongoing or being looked into in terms of PPE development.
There is quite some research going on, as on the other panel members already said. Let me first make one thing very, very, very clear, because that is important. It is possible to clean without sterilization, but it is never possible to sterilize without cleaning. That is one. Since disposable respirators cannot be cleaned, you can also not sterilize. So that's point number one. Point number two is that the effect of sterilization depends on the bioburden. And the bioburden of a used respiratory protective device is extremely high, extremely high. So you will never be able to make sure that all the viruses and other bacteria, there is more than just viruses, that they are killed. And that is an important thing. If you look at the research which is done in many parts of the world on reprocessing, because you cannot re-sterilize because masks are not sterilized, but on reprocessing respiratory protective devices, they looked as the primary outcome of the study was always filter efficiency. But they never looked, there is no study looking at facial fit and the compromise of the facial fit because of the sterilization effort. So they also, to my knowledge, did not look at the residual sterilizing agents. Like there is hydroxy peroxide sterilization, and they in one study they said, wow, that is the way to go, that is what we have to do. But then, and it was by coincidence, it was a Dutch professor, Vos, and he looked at residual levels of H2O2 in those masks, and they were extremely high. And then you will get, Kimberly, as you said, the skin damage and skin rashes because of that. Then there are other studies going on, and that is always in vitro studies going on the use of surgical masks. And some studies say you can as well use a surgical mask for protecting yourself. And those studies, if you look at those studies, they are very much underpopulated, so it's very, very low numbers. But more importantly even is that the guidelines and the laws. If you look at guidelines and laws, everybody knows that if you are in an environment where aerosols are present, then a surgical mask for sure will not help. And we create aerosols in intensive care units and operating rooms and in hospitals. So if a patient starts coughing, sneezing, he creates an aerosol, and we are not talking about droplets anymore. So in those cases, surgical masks for sure will not protect.
Okay, thank you, Geert. So I'd like to move on to the next question, and I'm conscious of time, and we do want to allow the audience to ask questions, and we do have questions coming in. So perhaps, Alberto, I'd like to start with you on this question, which is about the environmental considerations in terms of disposable of materials, because it's something that Karen mentioned, it's something that Geert mentioned as well. So in terms of the environmental impact and considerations, and again, if you can be relatively brief. So Alberto, you're on mute. We'd like to hear you, if that's okay. Thank you.
I will make it as short as possible. It has been considered that the increase of hospital discharge of this material put an extra cost of 3 million per single hospital per year. So it's a huge cost. But the problem is not of the hospital-derived waste. The problem is from the public waste, which goes into not in the cycle of infected wasting and dispose, but in the cycle of normal waste. So it runs the risk of being a source of infection as well. So this is a problem which still is unsolved I think in Europe, not only in Italy.
Yeah, and maybe I'll come to you, Elena, now. Geert mentioned the problems of, we can't sterilize masks. So how do we move forwards in terms of reusable materials? As a dermatologist, what are your main concerns around that? So if you can unmute, please, Elena. Thank you.
My main concerns are about the way we will wash those materials. In fact, fabric masks have a problem because you will use products to wash them that can create dermatitis. So this is the main problem regarding skincare. And the other problem in Spain is that fabric masks, we don't have standards, legal standards, even if there's more and more awareness, and authorities are highlighting the importance of using material that meets the standards. There are lots of material that may have products that can create allergies, and maybe products that will not protect you. So that's the problem.
Okay, thank you, Elena. So as we're now sort of 10 minutes before the end, I'm going to move to questions from the audience, our participants. And Geert, I'm going to put the first question to you, and it's from Matthew Wynn. Thank you, Matthew, for your question. Do you think that in order to protect skin under PPE, we need to move away from high contact products like FFP3 masks and adopt lowest risk products such as positive pressure hoods, particularly for protection against airborne pathogens like COVID-19 and flu?
It's a very good point, and it is completely true. You know, the best way to prevent skin damage due to wearing protective equipment is wearing no protective equipment or different protective equipment. And there are on the market also power air purifying respirators, the poppers, so to speak. And those poppers will definitely reduce the percentage of people with skin damage, for sure, 100%. The difficulty is that they can be disinfected. Yes, you can reuse those poppers. They are significantly and really significantly more expensive. But yes, if you have the choice, and if you have to wear a respiratory protective device for a longer period of time, a popper, a positive air pressure purifying respirator might be a solution. But you have to also take into account that they are sometimes difficult to disinfect because there is a hose between the headpiece and the filter, and that hose is corrugated, and it's very difficult to clean those hoses. So, but yes, it's a very valid point and a good point, but you know, never go away from protection. Just use the right product on the right spot on the right time.
Okay, thank you, Geert. The next question I'll put to Elena. It's from Saut from Indonesia. And Saut wants to ask about, they're usually wearing a surgical mask about 6 to 8 hours, and they have a problem behind their ears, which feels sore, and they get erythema. So what is your suggestion, Elena, to try and maybe prevent that happening?
Yeah, as the cause of this erythema is friction and continuous pressure, it's essential to take the elastic part of the mask away from the ear. So nowadays we have different devices to put around the head so that the elastics of the mask do not have to be on the ears, but you can put them together around and these devices are commercially available. And even if you can use creams with products to really to reduce inflammation, the most important thing is to take pressure out of the ear.
Okay, thank you, Elena. And Karen, perhaps I'll come to you with the next question from Jette Skiverin. Do you recommend skin film as a bandage or liquid? In which situation, in terms of putting on the skin some sort of liquid protectant, I would imagine they're talking about. Do you know of any studies that are related to the face skin?
So this, I think I just have to tell people to refer to their local guidance. So for example, the National Health Service, NHS England and the Royal College of Nursing has done quite a lot of information about how to protect your skin, what you should wear, what you shouldn't wear, what's flammable, what's not flammable. Yeah. And it depends what you can get in each country, Sam, as well, because it is quite different. So to recommend just one product will be very wrong because you don't know whether or not you can get hold of it. One of the biggest things to remember, though, is that when you are fit tested, you're fit tested with whatever product you've put on, and not just be fit tested, then go off, put a product on, put your mask back on because it won't fit properly.
Yeah, and Kim, maybe I'll just, thank you, Karen, come to you very quickly. Are there any different guidelines that you have in Canada in terms of use of sort of the liquid skin products?
So much like Karen has said, what we recommend is that, and if you're going to put anything between yourself and your PPE, then you should be re-mask fit tested. And that includes the liquid barriers. We do find that most of our people who go and get re-mask fit tested, if they're just using a liquid type barrier, you know, such as a skin sealant, that they don't have too much of an issue. However, they also aren't finding that much of a relief from the issues. We do see a lot of people with, to respond to the question earlier, with the issue around the ears. And the cheapest and easiest way that we found to deal with it is most of us wear caps on our heads when we're now in the hospital, and we sew buttons onto the side of our cap, and then you hook it onto the buttons.
Yeah,
it's cheap, it's easy. They do sell little devices that you can use as well, but you know, sewing it onto the cap seems to be the easiest thing to do.
Okay, thank you. Good. So I don't think we have any more questions that have come in. So I would like to thank the panel for your participation in today's session. Thank you for the participants for joining as well. Don't forget, you'll be able to access this video recording of the webinar on demand via the EWMA website within a few days. You can keep yourself updated about these via the EWMA newsletter, our social media, or our website. So thank you again, stay safe and have a good evening.